my ADHD family. Welcome to another episode of ADHD Love Parent Talk, where we talk about all things ADHD. Today, my guest is IngerShaye. I'm very excited to have her here. We actually are going to dive into a comorbidity, and another guest and I had talked about comorbidities as a whole, but I wanted to talk about ADHD and bipolar because recently I've been hearing a lot about people having those two diagnoses. So I'm excited. I'm very excited to have her. So IngerShaye, welcome, welcome, welcome.
Hi, how are you? It's so good to see you.
It's great to see
I'm always
you.
excited when I see your face.
So please tell the audience a little bit about yourself and why do you know so much about ADHD?
Wow, a little bit about me. It's very hard for me to just tell a little bit about me, but I'll try to keep it brief. So I am a mom of a son that has ADHD. So that's what led me down the path to really looking at ADHD. I'm also a psychotherapist and an ADHD coach. So when my son got diagnosed, I looked at all of the different rating scales and things they were sending. And I was like, that's me, that's me. Oh, that's me. So all those years, I didn't even know that I had ADHD. But as you know, when we get really interested in something, then we go down those rabbit holes. And I found out everything I could find out about ADHD and brought it into my psychotherapy practice as it was interesting. We don't get a lot of information, at least I didn't in graduate school about ADHD. It was about a paragraph and it was about little boys falling out of their chairs. Little did I know there's not a lot of research for ADHD in adults or things like that. So when I did my own research and I found out that I had ADHD, I decided to really become an ADHD coach and make sure that everyone in my practice was able to be diagnosed for ADHD.
Okay, and so when were you diagnosed and what type?
Oh, I was not diagnosed until I was 54.
Okay.
So that was a few years ago. And it's combined type. So I have, it is where it's a lot of contemplative, where it's like a lot of thinking, but then there's a lot of thoughts that are going on inside of me all the time. And, that's where the H comes out for me.
Yeah, that makes perfect sense.
So it's just very interesting. It's interesting.
That makes perfect sense. So tell me why did you decide to go for the diagnosis?
Well, I was so busy helping my son that when I realized that I probably have ADHD, I wasn't able to do a lot about it. Managing ADHD, making sure that they get all of the things that they need to be successful. Didn't leave a lot of time on my plate for myself. It wasn't until I'm a psychotherapist and I started to lose words and that frightened me. So again, I went to do some more research because I thought that I might have early onset Alzheimer's. And it turns out that, the ADHD and your hormones can cause that. And when I found that out and they said that treatment is one of the ways to make that, make it stop, but at least to help it, that's when I decided to go on a quest to get diagnosed. And it's been a few 2 or 3 years now. And so happy that I went to go get a diagnosis.
Okay, that makes sense. So for those who are trying to decide later in life if they even should bother getting diagnosed, I mean, there's a lot of people who have been, themselves for so many years. And plus there's that stigma around ADHD. What would your advice be to them?
Absolutely get a diagnosis or at least get treatment. The thing is, in order to get treatment, if you want to do medication, you have to get a diagnosis. You can't go with self-diagnosis. If you choose not to get a diagnosis, then you can do, there are different supplements, there are different natural ways to be able to manage it. There's always therapy and coaching. However, all of them in tandem is what really makes the difference as far as I'm concerned. And I mean, I'm in my 50s, but like we're dead. There's many, many years of life and you really want to live them to your fullest. And it doesn't change who you are. It actually makes you more of who you are because a lot of those racing thoughts, all those great ideas can now come to fruition because I can pick one instead of trying to do all of them. So it's helped me with my son to be able to then slow down and be able to help him learn to manage and model what that looks like, to manage his ADHD. So I would always suggest, make sure that you take care of yourself and that you can have the life that you really, really want when you do that.
Yeah, and that makes sense. It's really interesting when I went to talk to my therapist, one of the things that they said is, why would you want to struggle for the rest of your life, right? So there is a possibility you have ADHD. Why not get tested? And why not us put some strategies around, you know, basically supporting your ADHD direction. And I am so glad that I did it. And I really just did it because I wanted more validation, right? I really wanted to understand why I was doing the things that I was doing as I was growing up. And so that was a huge validation for me, but it became so much more once I got the diagnosis. So it does make sense. And to your point, you have so many years left. Why would you want to struggle if you don't have to? And don't get me wrong, everybody can't afford to do it, right? There are people who are struggling to go to get a diagnosis. And I do recognize that, but for those who can get tested, if you can, at least for me, it's been so beneficial.
Yes, I'd like to say that there is community mental health that is out there. I'm not saying it's easy to get a diagnosis because it's not. But there are different avenues to be able to get it instead of just having to go and spend, thousands with a psychiatrist or and someone else that can diagnose. There are different avenues to be able to do it. I drove about an hour away from my house to find someone that would do it with my insurance. So that was great because really it was just the copay. So you just have to look around, vigilant. It is really important to do that. And I just always want to say, like, I was already a psychotherapist. I was already having a pretty good life, but it was always just so I felt like I was juggling all the balls, like all the time, running behind. And with that, having to diagnose it just made that validated that point. And I realized I don't have to. So you don't have to have like a horrible life like the ADHD is not, you can always just live a better life when you're able to distinguish what's actually going on and then take care of it.
Okay, that makes perfect sense. So would you recommend the same thing for the diagnosis of children? So if a parent, same question, if a parent is struggling whether they should get their child diagnosed or not, what would your advice be?
I definitely would get my child diagnosed. I mean, I got my child diagnosed. The thing is, people think about stigma, and stigma is real. And they think about labels, and labels are real. But your child's going to get labeled with some type of label anyway. Wouldn't you want to be the one to control it, to control the narrative, and to let your child know that they're okay, that this is not something that has to be have stigma around it. It's just the way your brain works.
Yeah.
So that gives them the self-esteem to have the life that they want. So diagnoses is just more access to treatment, access to having the schools do the things that they need to support your child, and having your child just understand who they are and accept that their ADHD brain is it's okay.
I love it. All right, so let's move into the topic of ADHD and bipolar. So first of all, can you define what bipolar is?
We could talk for hours about what bipolar actually is, because there's bipolar 1, there's bipolar 2, and there's a lot of different symptoms. And with bipolar, we're going to try to keep it small. So with bipolar, it's characterized by a lot of mood swings. It's a mood disorder, changes in energy, sometimes distorted decision making. That generally, that's the different symptoms of bipolar. When you're manic, in your manic phase, that usually lasts for the manic phase is, I gotta make sure I keep it right. The manic phase can go for 7 weeks. And when you're in the depressive phase, it can usually go for 4 weeks. And that's generally when they'll say that you have bipolar. Some of these things can go on longer. And if you're hypomanic, it's a shorter period of time. But those are generally what they look for when they're going to say that you have bipolar disorder.
Okay, so is bipolar something that somebody is born with, or can you develop something like this over time?
Well, it's interesting. They don't really know how you get bipolar. It's something that runs in families. They have figured out that the brain structure is probably different for people with bipolar than it is for other people and people with other mental health conditions,
Okay.
but they're not 100% sure where it comes from. That's why it's important to take a family history to be able to have that a part of your treatment plan so they can evaluate you.
Okay, that makes sense. So what does bipolar look like? So you said that they may go through this depression phase and a manic phase. I mean, so is
Mhm.
that really what it looks like, or is it more than that?
Yeah, well, it looks, you go through your different phases and it's cyclical. And I think I said weeks instead of days to scare people. Your manic phase, I mean, lasts 7 days. And the hypomanic phase can be 4 days,
Mhm.
not weeks.
Mhm.
People will be very scared. The phase can last 2 weeks. That's where it's weeks.
Okay.
So I don't people be like, oh, I don't know what's happening. But with that, there's lots of different things that come with the mood disorder, but it is cyclical, which I think is very important because it'll happen in different cycles and times. Where the thing is, when you have ADHD, ADHD is something that's it's constant and ongoing because there's an overlap of different symptoms, and sometimes it's hard to differentiate between the two. It's interesting. I really hate the term disorder,
Mhm, mhm.
but to differentiate between the two of these characteristics that people have.
Okay. All right. So you did say that when somebody has ADHD and also bipolar, some of the similarities are there. So what are some of those similarities?
Mhm. Some of like excess energy, being easily distracted, frequent talking, that's one. Impulsiveness, behavioral and emotional management. Those are a few that definitely
Okay.
overlap. So, and when a clinician is not skilled in about both, sometimes they can look the same, especially well, in children and adults. Because you were asking about when are you born with it? They're
Mhm.
not sure about that, but the jury is out. Generally, they say that ADHD is something that's picked up in childhood, and we and more that bipolar is something that's picked up when you are a teenager or like early adulthood. But now a lot of clinicians are looking to see that children have disorder, and they're allowing that to be a diagnosis. So a lot of these things, they're not clear. The research is there's not a lot of research, and that's part of the issue. Um,
Mm,
Moving forward, I'm hoping that there's a lot more research. What's interesting is I did research to be able to have this conversation with you, and it was it was a bit all over the place
mm.
because there's just not a lot of research at all on these two things, these comorbid conditions.
Okay. And that's very interesting because it's something that's been around forever. But to your point, them as a combination, I guess I'm not too surprised that there isn't a lot of information out there on that as a combination, at least. Because that's what you're saying, right? As a combination, ADHD and bipolar, there's not a lot of information out there.
Yeah,
Okay.
yeah, there's not a lot of information out there, yeah, for the condition, together.
Yeah.
And interestingly enough, again, I think that a lot of clinicians, because they're not as well versed in the ADHD part, will then give that bipolar diagnosis because they know that, they're more familiar with that. And that can be part of the problem, even though many people that have bipolar will have ADHD, but it doesn't because you have ADHD that you're going to have bipolar.
Right. Okay. That makes sense. And so, how do people manage a comorbidity like this? How do they manage the ADHD and bipolar?
So that was interesting also because, earlier on, definitely it was, you're going to treat the disorder that is really bothering, someone the most, and that was bipolar. And, many of the articles that I read, scholarly articles, said that. But then there were also many articles showing now that you can treat both of them, or that you can treat sometimes even the ADHD first. But you need to really be in touch with your doctor. I think that's the most important thing. You need to really be in touch with your doctor and trust your doctor and write down the symptoms that you're having and any side effects that you're having. So usually what they would say, you're going to treat the body, because some articles say that the ADHD meds can make the bipolar worse. But then there are some articles where they find different medications that you can take, medications for bipolar and ADHD. So again, it's just really important to, trust your doctor, get a second opinion, and be sure that you guys are all on the same page about how to treat both of the conditions.
Okay. And so you mentioned medication being one of those treatments. Can people also use meditation, exercise? Are there other ways to help those two diagnoses?
Therapies that are usually used with bipolar disorder, family focus therapy, sometimes CBT, but sometimes CBT can exacerbate the bipolar. So you have to have somebody that is really well versed in it. Having great structures, a structured environment is very important. Psychoeducation is really paramount of importance to be able to help with it. So there's many different therapies that you can use. Some of the things, I always like meditation, but for some people, having to do it in the way that most people think meditation works, is not going to work for them, and actually can be agitating. Because when you have all those racing thoughts, delusional behavior, it's not so easy to do those things. So that's why these different therapies seem like they work a little better.
Oh, wow. I didn't even think about that, about it being agitating for some people, especially if they're not used to doing it and their mind is just moving, 50 miles a minute. So I didn't even think about it that way.
So
that's
depending where you are and what's happening at that time, especially since it's a difficult thing, as to what is going to work. So that's why psychoeducation is something that I really, really love. That's I use a lot for people that have bipolar disorder.
Beautiful. So is there any tips that you have for parents or even adults that have these, both of these diagnoses? How could the parents help their children, and how can adults help themselves?
Well, parents with, if your children, it's always a lot of love and support with our kids, and giving them that structured environment. It can be a lot to have to take care of a child that would have ADHD and bipolar. So it's for you to be able to pack your own patience and realize that this is going to be a journey. Make sure that you, like I said, know your doctor, trust your doctor, get a second opinion so that you feel comfortable in the diagnosis and that it's correct diagnosis. Keeping a diary for children and adults is really important, so you can see what's actually going on, how the medication helping. Learn to track moods, and all the things that are the circumstances around your moods. Those things are very helpful. And for so I guess it's for parents and adults, and for adults to have self-compassion. There's a lot of things that are going to go on with this. When you have radical self-compassion, it can allow you to then step back and look at what's going on, and then figure out the ways to be able to manage these conditions together. I think that that's really important, to be able to take a second and step back, and then be able and to report that to your doctor, and have that supportive environment where you can bring those things forth. Those are the ways that you're able to heal, so you can move forward and have a good life. You can life even though you have these co-occurring conditions.
Okay, I love that. So is there anything that we haven't talked about? Any last minute thoughts around ADHD and bipolar for the audience?
It's again, it's just interesting that there is much research, and that's the reason why it seems like it was a bit all over the place. Studies that were old or small sample sizes. And so it means to me that clinicians aren't really versed in this and they have their own opinions. I feel like you need to do your own homework so that you have a way to be able to speak to, the physicians and clinicians, and it makes sense when you do your own homework by trusted sources, right? So making sure that there aren't just ever it is just spouting things, which I think is really important, to really look at what the source is when you're doing your information, and then be able to go to your doctor and speak freely and get that second opinion. Not happy with what your doctor says, that get a second opinion. It's not always easy. And again, you got to pack your patients along the road with this. But if you are able to do that, you're able to get the best treatment plan that you can for yourself and your child.
I love that. Are there any resources out there? So I know that you said that you didn't see a lot of information, but is there anything that you could recommend, be it books or podcasts or YouTube channels, anything out there that people could go to and do some of their own research?
Yeah. So, on the internet, there's a lot of scholarly articles. There is it's Absard. I always make sure I have all the, but they are they really delve into ADHD, and they have articles on studies, because that's for the physicians.
Okay.
It's where the physicians are, and also, different articles I said that are reviewed. So when you look at an article, it's like, is it medically reviewed? That's very important to look at. Is it medically reviewed? And that way you'll know that the information you're getting is correct. I really like, for ADHD, podcast Translating ADHD, kind of breaks it down for everybody. Black Girl Lost Keys has a lot of information for ADHD. ADHD Essentials, it's a really great podcast that for parents, that's really great. Those are the ones that come to top of mind that, I make sure that I listen to. Oh, and Women with ADHD. That's also a really great podcast.
Very nice. And if anybody has any more questions for you, how can they get a hold of you?
Oh, and I forgot to say, and you, of course, because you always give great information.
Thanks.
It's true, though. I do. I love to watch, because I'm like, let me catch up on some things when I watch you and the guests that you have. I can be reached. I'm at IngerShaye on Twitter, and I'm at IngerShaye on Instagram. I have a page that's Black Women with ADHD, and IngerShaye.com is my website. So you can find me. If you Google IngerShaye, I'm going to appear.
Yeah, right.
That's how you can catch up with me.
That's awesome. That's awesome. Well, IngerShaye, thank you so much for your time. I truly appreciate this. This is really good knowledge. So thank you. Thank you for your time.
Thank you so much for having me. We just hit the tip of the iceberg with this particular topic. So again, I hope people go out and do their research, and maybe we can reconvene some other time, and you really delve into what it is to have both of these conditions.
I understand. Perfect. All right, everyone. That concludes another episode of ADHD Love Parent Talk. If you want more content like this, please do subscribe to this channel and make sure you hit that notification bell, because every time a video comes out, you will be notified. And if you like this content, please hit the like button. All right. Have a wonderful day, everybody. Bye, IngerShaye.
Bye. Thanks.